Hi everybody, Dr. Anjana Bana here and welcome back to my channel. And today we have our beautiful Beverly here. I think a lot of our patients know Bev. She's the one that's handling all your bookings. She's our patient concierge, all your inquiries, and she does a couple of treatments here at the practice as well. So Bev's always happy, always smiling, and she is a bit concerned about the creation of these lines. They're called nasolabial folds. And back when we started in aesthetics, that was the main fold or line that we used to, as they call, chase. So it's still a concern. It doesn't mean that aesthetic medicine's evolved. It's now looking at the holistic picture, that people aren't still bothered by it. But also, Bev is a very realistic patient, and we know that you can't be like completely smooth. You can't completely obliterate the nasolabial fold, or else you look, as they call it, simian. You look too full in the front. So we're going to soften up the nasolabial fold. We'll chat a little bit about it. And another concern for Bev is also the under eye area. So we've treated under eyes previously on other patients, and it's always important to remember what's that saying about the tortoise and the hare? Something about going slow and what I can't think of the exact saying right now. So yeah, so slow and steady wins the race, especially when it comes to teardrop fillers. So we put in very little, we underfill, and you may need 2 or 3 sessions after that, as well as some skin conditioning treatments under the eye, chemical peels, PRF, some mesotherapy to strengthen the under eye area. So, Bev, if you can tell us a little bit about your background in terms of like ethnicity, if you can please, elaborate on that, and then I'm going to explain why in terms of treatment.
So you wanna know about
like Tswana, you this, you that, whatever, yeah.
Okay. My dad is. He's a Pereira. And and my mom is Sotho.
Okay.
So it's a very funny combination. So I don't know what to call myself actually, because my dad is a Pereira and my mom is a Rakubani. So
okay. All right. So Bev, in terms of facial features, so different ethnic groups generally have different facial features. Bev has amazing cheekbones, and so that's the thing. We're not going to like plump up her cheekbones. We're going to address the nasolabial folds, and in a lot of African patients, that is a big concern. And usually there's a lot of volume. So Bev has a very sculpted face, actually, which is common amongst the Sotho people. So beautiful cheekbones, a lovely sculpted face. So we don't want to like overfill the area and go laterally and make you look European or Caucasian, giving you like these like sharp sort of, as they call them, Maleficent type cheekbones. You don't need that. We want a natural result. But that is a common concern generally in patients of color, and also Indian patients with round faces where we sag the nasolabial folds, these lines here. And they, for years and years, just as a little aesthetic doctor's secret, for years and years, we repeated this mantra of, you must fill the cheeks first, and the cheeks lift the nasolabial folds like this. But a guy called Lambros did a study and found there was no such thing. It was basically all in our heads, and that's something to do with perception and also reality and maybe social media and influence. So us so-called intelligent people were like reeled in by this marketing story about filling cheeks and lifting nasolabial folds when that isn't true. So from that, many of us, I hope, realize that we should critically before we treat patients. And even though, yes, it does give an illusion when you do treat a cheek, sometimes it's really nice to also just treat the fold. Okay, Bev, so we've disinfected Bev's face. I'm probably going to touch a little bit, so I might disinfect definitely again. Just a little thing on the nasolabial fold. So when I started about 12, 13 years ago, it was a very common thing to fill. And we used to use needles and just like poke away in there, fan, and do all these dangerous things. But we know now that this is the most dangerous area area to do something like that in. And mostly in terms of restoring the area, it's nice to go deep on bone in something called the piriform fossa and pop the nasolabial out. Or I'm going to do this today. It's called like using a cannula and going into the subcutaneous tissue slowly and filling the area, like so, bringing up the volume. But when you smile, like when you're at rest, actually, babe, you can see these lines there, and that also bugs patients. So superficially, we're going to do something called skin boosting using a skin booster, and using a technique I actually saw ages ago, and it's also like now very popular on Instagram, but it's a proven technique by Dr. Tom van Eyck. It's called the Fern technique. So basically building a scaffold and strengthening the skin, because when we age, it's from bone down to skin. So losing bone shifts in fat and loss of elasticity. Okay, we're going to start now. Okay, so Bev's got a distraction device. It causes a little vibration that disturbs the signal for discomfort. It's Gates' theory of like pain innovation. I'm going to actually explain it in another video. So we're going to start now, and then I had to think really hard because some patients call it that vibrating thingy or the vibrator or whatever else, which like elicits quite a bit of laughs, but we call it just the distraction device. Okay, Bev, ready, and go. All right, you okay? Mm-hmm. All right, if you turn to the side, Bev. So we've done one side, and you can see that thin line that we're still going to treat is still there, but the actual volume has popped up. So there is a difference between the right and the left. Now we're going to do the left side. Oh, Bev, you can put this here. All right. Okay. So we are using this distraction device. It creates a vibration, so it's non-painful input, and this is Gates' theory of pain disruption. So this non-painful vibration is going to disturb the signal from this point of discomfort to the central nervous system. So theoretically, it should feel more comfortable than if it wasn't there. So basically, it's a distraction device physically, and also the sound and psychologically as well. You okay there, babe? Mm-hmm. You fine, babe? You can put it here. Thank you. So I'm using a really robust filler to fill up this nasolabial fold. So something volumizing with, as I call it, a high G prime. So it's got quite a bit of elasticity, so it can withstand the forces of the muscles in this area. You can see it plumping up, but there's a slight line there. There we go. I don't want to overfill the area. So I'm going to use a Restylane skin booster now. So that's just for this line to soften it up, and it is superficial. So in this area is the facial artery, but it lies in the subcutaneous plane. So that's where we use the cannula carefully and slowly. And this is basically almost just intradermal. So we're strengthening the skin in this area. So for that very superficial line, not to inject into the line, because then you'll get lumping. And then just so you know, the gauze has disinfectant on it. And then from the other side, you create like a fern pattern. And you can hear the little clicking noises. That's like a specific amount of filler per little click, so we don't like over squeeze and overfill. That's why I like using the skin booster, because it's got this little clicker, especially in these sort of delicate areas and for these, you know, superficial treatments, so we don't get bumps and lumps. Core, you're right there, babe? Okay. And the other thing with this is these continual little injections in the area also. It's almost like a mini microneedling effect. So that added trauma also creates stimulation for collagen induction. So now I'm going to do the under eye area. Like I said, we're going to under-treat the area, and obviously Bev's a little nervous because it's close to the eye, but it's actually a relatively safe area to treat, especially with cannula. Danger zones are the area we just treated, the nose and glabella, especially with filler. Although there are no non-danger zones in the face, some areas are just safer than others, like, you know, the malar eminence, some parts of the chin, the lips is treated superficially and correctly. So we just have to know exactly where we are and at what level the blood vessels are in. And I've just recently acquired an ultrasound device, so that would be really nice to map vessels, as well as just knowing as well your anatomy and depth of vessels. So sorry, Bev. Okay, just relax. I'm going to give you a little poke. So Bev, you'll just hear a couple of clicks. Just relax. Here we go. I'm going to put very little here. Okay, that's it. So it's important not to overfill the tear trough, and also to be at the correct depth, so either on the periosteum and or under the muscle, not superficially, because that tear trough filler can stick around for many years. And as you can see, I put very, very, very little for Beverly. I mean, she is here. You can always come back for more sessions, which you probably will have to. And just to remember to underfill, because over 2 weeks, this filler is very hydrophilic. It likes water. It'll absorb quite a bit of water, and also it'll look more radiant, brighter, softer after 2 weeks. And we can always add filler, so I'd probably, you know, give it a space of at least 3 months before I put in any more filler in the area. And we're just going to do the other side. Okay guys, so thanks for joining me today. We've done Bev's nasolabial fold filler, as well as some fern technique in the nasolabial fold, and a bit of under eye filler for Bev. And if you have any questions about any of the procedures we've done, why we've done them, please drop them down in the comments down below, and like, share and subscribe. Thank you. Bye.